Well, the construction of laboratories that are critical in keeping us safe comes to a halt.
Yeah, the state lab is responsible for things like tracking and identifying disease outbreaks, lead contamination, E. coli in drinking water. CBS 17's Russ Bowen is here now. And Russ, why did construction on this additional space stop?
The federal funding freeze, money that was promised to the North Carolina Department of Health and Human Services was withdrawn as crews were already building.
You know, you can see new benches and then biosafety cabinets, which are designed to keep our staff safe from what they're working on.
But the reality is, if there is another viral outbreak like COVID in the near future, this lab and the ones like it down the hall won't be ready in time.
This space is going to be dedicated to our high-throughput virology testing. So HIV, hepatitis, things like that.
Last month, construction came to a complete and abrupt halt. Among the recent funding cuts from the Trump administration was $230 million due to the North Carolina Department of Health and Human Services. Within that funding was around $2 million to be used to complete the construction of testing space at the state lab in Raleigh. Dr. Scott Schoen is the state laboratory director.
The reality is that the federal funding cuts and the unpredictability of them really present a challenge with how we can navigate each day, much less the next several months.
It's here that threats like avian flu, measles, and other infectious diseases are tracked and identified. Blood work for every newborn in the state is tested, as well as exposure to things ranging from lead to rabies.
We are here to keep North Carolina safe. We have the staff and the expertise to respond to the threats that we currently face. The reality is that federal funding cuts jeopardize the sustainability of that response.
Dr. Schoen says staff moved into a fraction of the space they were using prior to construction until work could be done. They are able to keep up with the demand so far, but any sudden and large outbreak could be a different story. And there's another issue. The cuts didn't just hit state health departments, they also hit the CDC, and that agency's labs states rely on.
That does shift the burden to the states. And where we have to look at testing that was previously done in Atlanta, is that something that we now need to pick up here in Raleigh? And is that funded? A
lot of expansion funded by the government at the state lab has been completed since COVID exposed the real need, but they're not there yet.
All of the work, all of this funding started with COVID, but it is addressing these long-standing infrastructural challenges in public health and public health laboratory science.
And now is the question of whether this will be solved in court. Will the state legislature have to find a way to make up the difference? Every option, guys, is very much a part of the conversation.
Yeah, because it's so vitally important in what they do. So it's going to be interesting to see how it shakes out.
And I will say it is striking to see that in person. I see all these people working really hard to keep us safe in those labs, and then just that freeze on construction. It's something to see.
And so quickly, too, All right, Russ, thank you.